So to prevent the long-term effects of all of this really being a part of your daily life, what can you do to seek relief and respite from nasal congestion safely? Dr. Leong Lin, a consultant ENT surgeon from Singapore General Hospital, is with us. Dr. Leong, we left off talking a little bit about when you should contact a medical professional when it becomes something serious for you. When you do, what are the treatment options that are open to you? Like you said, your first option would probably see whether or not they respond to these medications. If they do not, what happens next?
If they do not, then we actually have to look into what's the cause of the congestion. A lot of times when you see a specialist, an ENT specialist, specific, you have to do a nasal endoscopy, you look into the nose. A lot of times you might see things like polyps, you see lots of pus, then that clinches the diagnosis of a sinusitis or a nasal polyposis. Then the treatment slightly is a little bit different, and that might involve taking steroid tablets, and that might involve taking antibiotics.
Are there more common causes than others that you see during these endoscopies?
I think, but most of the time we actually do just find plain swelling in the nasal cavity, nasal lining, and that would be the cause would that be of allergic rhinitis. So allergic rhinitis, the medication that we use most often is actually a steroid nasal spray, because most of our patients actually have the problem all year round, and that is the best medication to use to relieve nasal blockage. But to achieve a quick relief on nasal blockage, usually is the decongestants, and they come in two forms: the topical, which is the nasal drops, or you can have the tablets. However, those are not for long-term usage, more to relieve it quickly so that the patient can actually feel good in a short period of time.
So just at that point in time where it's very acute, where you're having and suffering from the congestion significantly, so let's say you're having it for 1 or 2 weeks, after that you stop. That's it.
You should, yes.
Right. But you can continue with the steroid sprays then?
Yes. These steroids are actually very low-dose steroids. They work only on the nasal lining, and it does not go into the bloodstream. So it's very safe for long-term use. Some of them are even safe for children up to 2 years of age.
Up to 2 years of age, even. Okay, so how is this working actually to reduce the swelling in the membranes?
Yes, steroids can actually calm the mucosal lining and reduces the inflammation within the lining itself.
Are these steroid sprays standard, or is it different from person to person?
They're fairly standard, and there are many different brands available. Yes.
Right. Okay. So, but nothing to worry about in terms of the combination of the percentage of the steroid or anything of that nature. It's roughly around the same area.
Yes, they're all quite comparable.
Right. Okay. Terence also has a question with regards to these nasal sprays. He's standing by right now. Hello, Terence.
Yeah. Hello. Good afternoon, gentlemen.
Hi. Go ahead with your question for Dr. Leong.
Okay. I have this nasal blockage for many years, maybe 5-10 years, and I consulted the polyclinic, and they gave me those nasal spray like short base or something like that. But I find them not to be very effective. So last few years I have been buying the nasal spray from the pharmacy called Deviated, and I have been spraying into my nostril to relieve my blockage, and it works very, very well. There was once when I went to the polyclinic to consult the doctor, they sent me to GH to do a scope, whereby they put a tube through my nostril to check, and they discovered that there's my bone is slanted towards one side. Is it a cause for the blockage?
Right. So in Terence's case, is that a deviated septum?
Yes, that's probably a deviated septum. But Terence, a majority of the people do have deviation. However, it depends on the severity. Yours could be severe, and that can contribute to your problem. Now, the other thing that I find is that the usage of Iliadin, okay, that you have to stop. All right, because that medication used on long term actually destroys the lining of the nasal cavity. So you might feel congested even though you do not have any swelling. Because what happens is, in order for us to feel that we are breathing smoothly, there are receptors on the turbinates, on the nasal lining, that detects movement of air. So when you use Iliadin, it actually thins out the mucus and it destroys these mechanoreceptors, so that even when you are not blocked and you breathe, but you do not detect air movement, and you actually feel blocked more.
So over the counter nasal sprays. Very different from the prescribed nasal sprays.
Very different.
Right, so you want to make sure you control the usage of that because continued exposure could reduce that inner lining. Same thing with decongestant tablets as well.
Yes.
Same thing. You want to actually hold that after a little while?
Well, decongestant tablets actually do not have any direct effect like that, so it's okay to take it for a while. It's just that decongestant tablets actually causes constriction of blood vessels. So people who have hypertension, you have to be careful. It can bring up the pressure a little bit.
Let's talk about some of the other treatment options that are available. What's very common nowadays, you see it a lot in pharmacies, breathing strips that you can actually paste on your nose, and it's claimed that it can help you with your nasal congestion. How does this work exactly?
The nasal strips are basically non-medical kind of treatment, and what it does is it's a strip that you can paste on the nostrils, on the outside of the nose. And it actually works on the narrowest part of the nose. And the narrowest part of the nose is what we call the nasal valve. And that is bounded by the turbinates, which are the two swellings you see at the front of the nose with the septum. So if you can increase that area, the studies have shown that actually the patient can increase their breathing capacity by about 31%.
Right, and I've also read that it can even be used to help with snoring issues if you're a severe snorer. Is there some truth to that?
Yes, sometimes if the snoring is due to a nose blockage, it can contribute to the snoring, yes.
Yes, well, who would you recommend utilize such breathing strips then in that sense? Do you recommend it to your patients?
Yes, there are certain patients that actually cannot use medication that I prescribe. One particular group that I have are patients, are the pregnant ladies. A lot of times you can't give them decongestants, you give them antihistamine. Antihistamine actually, by the way, does not work on nose blockages. So
that's more about the allergy issue.
More about the allergy and less on the nasal obstruction.
Right.
So for temporary relief, using the nasal strips might be the answer.
So if you wear it all throughout the night and you've used it while you're sleeping and it's opening up those passages, does that mean that what kind of effects are you going to be able to see in the day, for example? Is it going to stop you from having the runny nose because you've been able to have those open passages all night?
No, it just specifically relieves the nasal obstruction. It does not take care of the rest of the problem.
Right, making it easier.
Make it easier for you to breathe, easier to sleep, and feel much better. Actually, generally, if you do sleep better, the nose does behave better the next day.
Ah, okay. Well, we do have time to squeeze in just one last question standing by. David is on the phone with us. Hello, David. Hi, David. You want to turn your radio volume down, David? Listen to us through your telephone. You'll be able to participate that much better, all right?
All right, Daniel.
Hi. Okay, go ahead with your question for Dr. Leong.
Hi, Doctor and Daniel.
Hi.
Okay, great. Every time I go swimming, after a few laps, my nose starts to run and start to sneeze, and this continues through the whole night, even after I stop swimming. So I went to see the doctor. The doctor said, hey, this is built into your system, and there's no cure for it. So how true is that?
Right, I'm sure many people actually have had this experience, like David as well. Dr. Leong, this is very common. After swimming, you actually see running nose issues?
Yes. Certain people do have mild allergies. Now, the moment you have an allergy nose, there's some inflammation going on, and that makes the nose less able to tolerate changes in the environment. So if you're swimming, I presume the two things we're looking about is one, chlorine. That's an irritant. And number two is the temperature change. So those two things, it can tip the nose over. So once your nose is unable to balance out and take care of the change, it starts running, you start having nasal congestion, itching, or even sneezing.
So is there really no treatment option? Is there nothing to help in this situation?
No. If actually there are certain events that you know that will trigger your problem, you can take an antihistamine before the event, about 2 hours, and then that can usually take care of the problem.
Right.
If it's very specific.
Indeed. Well, so what is the way to find out all of this? The triggers and the allergens. Do you have to go for an allergy scratch test?
Yes, you will have to go for the scratch test.
And that will be able to pinpoint and identify what the triggers are.
The common one, yes.
The common ones.
Yes.
Right. Well, thank you so much, Dr. Leong Jun Lin, our guest in the studio today, consultant ENT surgeon from Singapore General Hospital. And thank you all for tuning in to another edition of Body and Soul right here on 938 Live.
938 Live.